Hello and welcome to my YouTube channel. Today we will gonna talk about a very important topic which is CD urography. So let's start with today's video. Today's presentation contains at first a brief introduction of the CD urography, then the anatomy of the urinary system, followed by the indications and contraindications of the CD urography. After that, the CD protocols and later the references. So, what is a CT urography? A CT urography or CT urogram is a test using a CT scan and a special dye that is actually the contrast media to look at the whole urinary system, which includes three main organs. One is kidney, which is a blood filtering organ, ureter, which carries the urine from the kidney to the bladder, and the bladder that stores the urine. Now, the acquisition of images is done in the excretory phase with multiplanar imaging of the urinary system. That means multiplanar means from it is a one type of post-processing technique from which you can create multiple plans. Means you can create coronal plans, you can create sagittal plans from the original aquard plans, that is the axial plan. So now the anatomy of the urinary system. Urinary system includes three main organs, as I previously said it, which is responsible for the filtration of blood. That means it filters the blood and the production of urine as a excretory material. By filtering the blood, it creates urine as a excretory material from our body. The three organs are kidney, ureter, and bladder. Now, what is kidney? This is the kidney which acts as a blood filtering organ. This is the ureter which carries the blood from the kidney to the ureter, and this is the bladder which stores the blood. Now, if we want to know that how the contrast media goes to the kidney by flowing through all the circular system of the body, we need to know the blood supply of the kidney. So, blood supply through the kidney is done by the two blood vessels, that is renal artery and renal vein, which is a branch of the abdominal aorta and inferior vena cava. Now, the efferent arteriole carries the blood to the glomerular capillaries, and where the filtration of blood takes place. That means the glomerular capillaries is the place where the filtration of blood takes place. Now, how contrast media reaches to kidney? At first, we inject the contrast media in the median antecubital vein, from which it goes to the internal jugular vein. After that, it goes to the superior vena cava and it enters the heart in the right atrium. Then it goes to the right ventricle. Then it reaches the pulmonary artery, and after that, it goes to the left atrium of the heart, and after that, it goes to the left ventricle of the heart, and then it pushes through the arch of aorta, and now it goes to the thoracic aorta. After that, it goes to the abdominal aorta, and from abdominal aorta is go to the renal arteries, and after that renal arteries, it goes to the microvasculature of kidney like the afferent arteriole and glomerular capillaries. After that, it comes to the renal vein, and renal vein gives the blood to the iliac vein, and iliac vein returns this blood to the IVC, and whole the circulation is complete now. Now, what are the indications of doing CT urography? At first, stricture of the ureter or ureter narrowing, then hydronephrosis. Here you can see this is the hydronephrotic kidney. Then ectopic kidney, it can also be an indicator. Then preoperative follow-up, this can be also an indication for CT urography, and kidney metastasis or kidney cancer. Now the contraindications. If you are pregnant, it can be a contraindication to CT urography. If you are allergic to the contrast media, then it also be a contraindication to CT urography. And renal impairments, that means abnormal creatinine and burn report. Now, how you will prepare a patient who will be undergo a CT urography examination? At first, you will check the UHID of the patient, that means the unique hospital identity. Then you instruct the patient that he or she has to be 4 to 6 hours of fasting. Then you will check the creatinine and burn report of the patient. After that, if the patient come to the department, and you will ask him to remove his all radiopaque materials from the area of interest or change into hospital gown. Then you will place the ECG leads over the chest region to get a ECG cycle or cardiac cycle during the scan, and after that you will insert a cannula in the medial antecubital vein, and you will load the pressure injector. Now, what is the appropriate patient positioning and scan phases or protocols? So, the patient position will be head first or feet first, supine on the table with the hands are raised above the head. As you can see in this picture, the patient is lying supine. The protocol is the head first, and these hands should be raised above the head. Now, what are the protocols or what is the phases of the scan? At first, you will take a topogram of the image. Then we will give a plain scan of the image. After that, there will be a spot for the contrast media, and after that, you will inject the contrast media through the pressure injector, and there will be a pre-monitoring phase. And after that, the monitoring arterial and venous phase will be taken, and after a 30 to 55 second or 5 to 6 minute delay, you will take a delayed phase to create the urogram. Now, what are the scan parameters? The topogram landmark of position will be in the xiphoid. That means the xiphoid process will be the topogram landmark to center your patient. Now, topogram direction will be craniocaudal. That means from the cranium to the feet side. And scan type will be helical. The scanning location, the start location will be 1 semi superior to the diaphragm, and end location will be the lesser trochanter or 1 semi inferior to the pubic symphysis. Now, breath hold, the scan will be in inspiration mode. Contrast media, the type of contrast media will be non-ionic low osmolar hydrogenated contrast media such as Omnipac, and the route of administration will be intravenous. Then after that, the volume of contrast media will be 80 to 100 ml, and it depends on the patient demographic information like the weight and your experience also. Rate of injection 4 to 5 milliliter seconds, and depends on the capability of vein, and that means the how the vein is clear or not, and this is depends on that. Slice, the slice thickness will be 1 to 3 millimeter, and the interval will be 1.5 to 2.5 millimeter. The reconstruction algorithm will be medium smooth kernel will be the reconstruction algorithm. The tube current will be 120 to 140 kbp, and the tube voltage will be 250 to 300 mAs. The scan time will be less than 10 seconds, and the image format will be diacom. Now, here is a case study to get a proper overview how a citiogram look like, or how a citiogram involves or helps in diagnosis. The patient name is unidentified, age is 55 years, gender is male. Complaint, the main complaint of the patient was suspected ureterolithiasis, and the diagnosis is swollen right ureter with a detection of calculus in vesico-ureteric junction. Here we can see this is the swollen right ureter, and there you can see in this image, this lateral image, you can see there is a gap between the bladder and the ureter, and there is can be a suspected calculus in the vesico-ureteric junction. This is the anteroposterior urogram. This is the lateral urogram. This is the posterior part of the urogram. Thank you so much for watching the video. If you find it educational or helpful to you, please do like, subscribe, and comment on the video.